Good afternoon, everyone. I'm very excited to be one of the RSNA Fast 5 speakers because I have the opportunity to tell you about our project to create and publish patient-friendly summaries of American College of Radiology appropriateness criteria. I would like to thank and acknowledge the AC Patient Engagement Subcommittee members and the layperson authors. By some accounts, medical errors are the third leading cause of death in the United States, taking anywhere from 1/4 to 500,000 lives each year. It's estimated that radiology is involved in about 20% of these, including non-fatal errors. Radiology is part of the full continuum of care: screening, diagnosis, and treatment, and thus we have a wonderful opportunity to make an impact on this distressing metric. Appropriateness criteria are updated evidence-based guidelines for best imaging for 178 diagnostic and interventional radiology topics covering over 1,500 clinical scenarios. They address patient safety by providing guidelines to avoid a wrong test, including unnecessary follow-ups. They're an excellent resource for referring clinicians to pick the right test for their patients. However, patients sometimes challenge the test or insist on a different test based on word of mouth or Dr. Google. The referring physician can't give the AC to the patient. These are long, full of medical terminology, and not understood by lay people. As a layperson, I was not aware of ACs. Like most patients, I relied on my doctor to pick the right test. I became aware of these in my role as an associate editor for JACR. In September 2016, just as I was struggling for a diagnosis for my limb, my back, and hip pain, I read the AC for low back pain. Contrary to my expectations, an MRI was not the appropriate test for low back pain without concerning etiology or symptoms. It occurred to me that it may be impactful for patients to have this information. It may avoid unnecessary tests at patient insistence due to lack of knowledge. So I approached my editor, Bruce Hillman, about my suggestion. He seemed a little skeptical, but said, "Hey, give me an example of what you envision these to be." So I wrote a short summary of the low back pain AC, sent it to Bruce, he liked it, and the project was born. The project is a collaboration between JACR, ACR, patients, and patient advocates. They are short 250-word summaries of ACs in patient-friendly, easy-to-understand language. They're written by layperson authors and checked for technical accuracy by AC subcommittee co-authors. They are meant to improve communication between patients, referring clinicians, and radiologists to help patients understand appropriate imaging for their condition. I'm the associate editor for the project. We have 7 layperson authors. We've published 17 summaries to date, with many more in the pipeline. The table shows the first 14 ACs that we published with the number of downloads and page views through the end of July 2018, ordered in the order of publication. As you can see, the earlier ones have more downloads in general, but there are some that have been more in demand: imaging for suspected pulmonary embolism, low back pain, and minor head trauma. We're working to disseminate these more widely. We have published them on JACR. We have links from radiologyinfo.org, JACR, and ACR websites. We've written blog posts, journal articles, shared on social media, and presented at conferences, including here at RSNA. We need your help. We want you to help us disseminate these. Tell your colleagues about them, give them to your referring clinicians, give them to your patients, put links to the summaries on your patient portals and on your radiology websites. I would also encourage all of you to use these patient summaries to help you engage with your patients. Thank you.